Here we are at week 9.
Great. So maybe we can just jump in with the first question. What are the risks associated with MDMA and psilocybin?
Yes.
I happen to have. Oh, sorry, go ahead.
Oh, well, um, yeah, I mean, there in the first paper that I read for this unit, they outline all of there are like risks, physiological risks, and then there are psychological risks or side effects. And most notable to me with, I guess, psilocybin, it seemed as though the risk for the physiological sort of risk or negative side effects of psilocybin was pretty low. Um, with MDMA, what was notable to me was like sort of cardiology, like cardiac stuff, and acute, what was it, serotonin syndrome or acute something syndrome, where there's a flood of serotonin in the synapse. So those were the ones that stood out to me. But I also just wonder about dependence, drug dependence.
Yeah. Yeah, I think another one that's coming up, and this is like less of like just like a pharmacological like direct like effect, but just like hearing about like the just like sexual assault in therapy spaces where these like drugs are used. That is also just something that's coming up for me, just like the kind of loss of agency and like in those settings.
Totally.
Yeah, the contextual aspect of it. That's a good point. That didn't that wasn't specifically called out in the book, but something similar was so there's page 321 was talking about the risks, and it said, psilocybin and classical hallucinogens are physiologically safe, but they sometimes are associated with fatal accidents. So that is kind of like the context in which you're in when you don't have all your wherewithal to kind of protect your body boundaries, or even, your safety is something worth considering. I think it was also interesting for the MDMA stuff. You're right. I think you're right. It did say it was cardiovascular issues. And then there were a bunch of random things. I mean, maybe they're not random, but like lockjaw, teeth grinding. I saw that, restlessness. I mean, the anxiety was interesting because especially because it's applied for a lot of people with PTSD and with anxiety, but it seems like depending on what your physiology is, it could actually increase it for you, at least maybe initially. But some of the other stuff, dry mouth, insomnia, concentration, difficulty, and impaired balance.
I do think also with both of these, with withdrawal symptoms from MDMA, that there can be some irritability and increased anxiety especially after MDMA. That may exacerbate depressive symptoms or anxiety in people who experience them. So I think of that. Also, I think about there's a risk for me, like in sort of the traditional psychedelic forms, psilocybin or ayahuasca, they didn't talk much about ayahuasca, but the appropriation of these drugs, I think there's a risk in that, and the appropriation of the culture, and the medicalization of some of these, and the tourism of all of it. I think that is also a risk.
Maybe also with MDMA, since it's synthetic in that it's not like a plant medicine, that it could be cut with something or just not pure.
Yeah.
So I imagine that most psychotherapists or psychotherapy assisted, whatever, you know what I mean, using this in a psychotherapeutic sense, it's tested, but maybe not always, especially because it's still underground for people who do MDMA assisted therapy. So it's possible they might get something else.
Yeah, you hear a lot of like, the like fentanyl laced party drugs, or oh, okay. I guess we have to switch. But yeah, that is totally a risk. I agree, Colby. So shall we go to the second question? Um, are the effects of drug-assisted psychotherapy purely pharmacological, psychotherapeutic, or both?
And also, why may this be a challenging question to answer?
Hmm.
Um, yeah, this question was really interesting to me. I think yeah, when I first looked at it, I was like, how do we even tell? But I guess it's it's curious to me about like of course when you like take drugs, you're gonna have some kind of profound experience, or like you can have some kind of like profound experience. But then I think I get really curious about like what are like the long-term effects coming out of it. And like with some like ketamine trials that I've seen, it like when they're not really like assessing for like the long-term effect, I start to like wonder about like, well, are you just saying like people went into the experience, had a good time, and then is that the study? Um, but I think I'm kind of losing my train of thought, so I might just allow other people to jump in on your own thoughts on this question.
Yeah. Well, I think from my understanding, like I went to this it was years ago, but I went to this psychedelic assisted psychotherapy conference through it was
Oh,
hosted at
cool.
UCSF. It was through MAPS. And they talked about set and setting. It's very much like the mindset that you're in and the setting in which you do the psychedelic is super important. And I think that um how does this tie in? I mean, I feel like yeah, the any where you're already in psychotherapy, and that's that therapeutic alliance is so important. And I think that it may be one of the most important aspects of therapy. And so um, uh, increasing this level, the sense of trust, or the sense of breaking down those walls or fears that you may have, it can, I think, maybe deepen into the therapeutic alliance. So I think it's synergistic, maybe.
Yeah, my instinct when I read the question was both. It seems like some substances have a, a very noticeable impact on one's physiology. And so you could be like, okay, that is biochemically impacting you. Um, well, I think they all do on some level. I think that's what I understood, Aspen, your point was. And I think it's come up before, like drugs have side effects, drugs have effects, all drugs have effects. But I do think it's also psychological. And so, yeah, I guess what I'm missing is, why is this a controversial question? Like, it seems like it's physiological and psychological, and therefore psychotherapeutic, like the alliance. How are you all seeing this that I'm missing?
Maybe a challenging question.
Or the effects of drug assisted maybe I'm not supposed to say that I'm not understanding the question, but um
um, I'm seeing it as kind of like like with one of those studies that we read, it was like, okay, so you have like these two psilocybin trips, and then like 3 months later, somebody's depressive symptoms are a lot better. So like, there's some question for me in there of like, is it about like the psychotherapy that happened as they were tripping, or is it just that they took psilocybin twice and now their depression is like better? And like, yeah, I do think it does really seem like a both. And what you're saying, Aaron, about like set and setting, like it's like being in the therapeutic space can make it a lot safer. It can make it probably like easier to have like a
oh,
safer trip. But
I so like the contrast is like versus just taking drugs on your own, or like not in a therapeutic setting, would you still have potentially the same impact?
yeah, or like, is it something that you can just empirically be like, oh, you've taken this twice in this therapeutic setting, therefore things
I
are
get
better
it.
versus
I
the
get it.
I mean,
relationship thing.
Yeah,
Huh.
it's been, as you're speaking, I'm also thinking about, and I don't know about this comparison, but it's just like bringing for me, taking any kind of psychotropic medication without therapy. Like
Yeah.
you're going to get the benefit of an SSRI perhaps, but will it be as long term if you weren't taking it alongside psychotherapy? Is it, you know, are you just getting the benefit of the immediate benefit of, or, you know, the benefit eventually of an SSRI? Does that make sense?
Yeah, I think that that's a nice combination. It sounds like in the psychotherapeutic setting, it can amplify. Aspen's like, shut the hell up, Colby. And I'm just kidding. It can amplify. I mean, it's you're this is so helpful. It's actually making sense of the question for me, but it amplifies the impact of the psychotropic. And so to Aspen, your point, it could still have an impact, but it could be if that person is skillful, or to your point, Aaron, like the set and setting is thoughtful and the like cast is thoughtful, it could just be an exponential impact. So it is both.
I
Or
think both.
yeah.
Yeah. It also strikes me as like a lot of like psychedelic drug assisted therapy, just yeah, that it seems much more like holistic, much more spiritual, psychological, like fully taking in the person than like with other drugs that you might be on pharmacologically. Um, so that is like another place where I could see the like psychotherapeutic piece of like very important beyond just the pharmacological.
Mhm.
Okay,
Um,
I know we're at 10 minutes or beyond that, but I just to add to that, I think that
This
I
is
think
pure discussion. This is what she wants. It's great.
I think that also like in, you know, if you were using like a traditional medicine, and I think what's helpful for that, or what the healing aspect of that is, you know, maybe it's the medicine, maybe it's the plant medicine, but it's also being held in community, and also the yeah, it's really the setting, it's the people to hold you, the people to be there for you when the experience is over, you know, when you know, you can take the drug and have this mind-blowing experience, and maybe it's like
Mhm.
it's maybe it's too intense, and you need the framework of a community or psychotherapist or someone to actually be able to like help you through that,
Yeah, the integration part.
the integration.
yeah,
Yeah.
like
That
we just
okay.
have like 2 more minutes.
Oh.
Okay, very really quick. But have you heard this phrase? Oh, bloody hell, I forgot it. Okay, great. Time to move on. I was gonna contribute. Oh, I don't know. All right. Well, how can we talk legally and ethically about this with our clients?
Yeah, I think the first piece that comes to mind is just making sure that we like stay within our scope of competence and practice. Like even if we have our own experiences with
Yeah.
psychedelic, recognizing that that doesn't count as like training and being able to hold this for other people.
I think that's a really good point, and I
Yeah.
don't know if a lot of people are holding themselves to that standard.
Yeah, right on. I agree, Aspen. I think that's brilliant.
I
Yeah.
think it's not, I mean, ketamine's legal. It might become MDMA and psilocybin might become legal, but I imagine we can answer questions to it, and if we really caveat, you know, our expertise, rather than like suggest it or introduce it. Ethically, I don't know, you know, if we're in a position where we can any psychotropic, if we're allowed to kind of suggest it. This feels like a juicier question to me than even the second one, because I think a lot of people want to ask about this, and where do you get to talk about it?
Mm-hmm.
Yeah. And I think, yeah, appreciating what John Lynn added, that we can just always talk to our supervisor about it, and that might be the best thing to just be like, hey, I don't know if I can talk to you about this effectively right now. I'm going to talk to my supervisor and get back to you.
Mm.
And we should probably,
Mm.
we have like 15 seconds left.
Ooh, yeah, we should cut it off here.
No
Okay.
more.
Thanks.